emphasize the concepts of integrating the mind, the body, and the spirit, working together in concert to promote health and healing. He will share with you some of these concepts during his lecture today, preparing the patient for surgery. It is a pleasure, deep pleasure, to introduce Professor Hernandez.
Thank you very much for such a nice introduction. It's always a pleasure to talk to groups of hypnotists, and always nice to see some familiar faces in this crowd, people that I haven't seen for quite some time since they've taken some of our courses. The subject of hypnosis and anesthesia is very close to me, seeing that I am a nurse anesthetist by profession, and that years ago, after I took basic courses in hypnosis, I tried to determine what was it that I was going to do with all these concepts that I had learned and apply them to what I do. And it took me a period of almost 10 years to develop methods that I can use, or situations, identify situations in which I can use hypnosis without the use of trance. As you can very well imagine, life being what it is, hypnosis is a wonderful tool, but it is time-consuming. And in our operating rooms, when they cost $80 a minute, you need to do X number of procedures and put X number of patients through in the course of a day. So the luxury of using hypnotic inductions in clinical practice, in my type of setting, is very unproductive. However, the use of hypnotic suggestion without trance induction is of great benefit to the patient. When preparing for this talk, I thought of what can I say to a group of hypnotists that are not anesthetists themselves and that don't have the opportunity to deal with patients one-on-one. And so I broke the talk down into two sections, one of which I will present to you, and that is, what is it that you as a lay hypnotist can do to prepare your patients for surgery? The hypnotist's job in preparing the patient for surgery and for the hospital experience is primarily based on decreasing fears and misconceptions through the following three concepts. First is to reframe the patient's point of orientation towards the procedure, the hospital staff, and the hospital routine. Most people's orientation towards those three things are based upon old wives' tales, anecdotes, and misinformation. And unfortunately, all these is understood at whatever level of understanding and education these people happen to have. I don't have to tell you that when a doctor announces to you that you are going to have a certain procedure, the first thing you do is tell all your friends, and invariably all those friends have some kind of anecdote that they have to relate to you, and it certainly never is a good, happy ending. It's always a tale of woes. And the patients need to know, your clients need to know, that everyone is an individual and that not everyone is going to experience the same vicissitudes that your other or the teller is telling you about.